Yes, they could. Hi everyone, my name is Kayla Green. I am here doing my project. Today we're doing a surgery on um, a sharp surgical. Oh, I had that word just a second ago. Give me a second. Debridement. Debridement. Sharp surgical debridement. This is the surgery we're going to be working on. We're getting together. Here's a list of the equipment that I will be using. I have toilet paper. I'm going to use that as a non-inhibit dressing. Basically, it's the stuff that I put inside of a wound to make sure that it stays dry and keeps the skin protected from any type of debris and stuff. I'll be using let's see here, the second toilet paper for the same thing for larger wounds. If it's a large wound, deeper wound, I have like 2 pieces of toilet paper for that. I'll also be using a folded paper towel for sanitized gauze and the bands. So I have a paper towel in here, tape around it. That's what we got. Oh, the wound is a pack of noodles. Sorry about it. What else? Got the blue packing tape. I already named that. Okie dokie. Next, I introduced myself. All right, let's go ahead and start jumping into this. I have skin prep. Basically, it's a sticky stuff of gauze we like to use in hospital, but I'm gonna use that for my perfume bottle. And then I have wound spray or wound cleanser. I'm going to use that for my deodorant body spray stuff. Okay, so normally what I do is I wash my hands, got on gloves, pop, let's say it happened. I'll go in, I'll assess the patient, I'll talk to the patient, make sure they're cool. I'll go in, I'll see the wound, I'll see what's going on with it. I will then take my wound cleanser, I'll spray in there real good and make sure it's all good to go. There you go. Then I had to add another thing in there, and I do apologize for that. Then I'll take a gauze, piece of gauze that's laying around, or not laying around, but obviously it's inside of the sealed container. Sorry about that. But this is a regular napkin. I'll be taking the gauze and I'll dab within the wound, around the wound, and inside of it to try to help get some of the debris out of the wound. And then I'll discard this in the garbage. Trash it out. Then I will take the, I called them tissues earlier, but they are actually, where's the name of it? Non-hearted layers. I guess that's the proper name for it. Sorry. I'll take some of these and then I'll pack it into the wound. Depending on how big the wound is, you might need 2 of them. So then I'll pack it deep in the wound, or at least I'll pack one of them deep in the wound just to make sure it's in there. Then I'll go in with my skin prep. Don't spray it inside the wound. You want to spray it around the wound. Spray around the wound. This helps for like to make the skin a little bit more sticky, and to help with this ACE bandage, or not ACE bandage, but the AB band to go in and actually seal on the skin and be able to be flush to the skin. A lot of wound nurses use them too. So then I'll take another piece of the gauze basically, and this gauze will always be wet. They'll measure, you want it dry, but you want it like, and that's weird because honestly, some people say they have it dry, but with like the some type of medicine moisture in it. I don't know. Me personally, when I'm doing it, I pay attention to whatever I see in the wound cares do. Wound cares usually have the wound spray, and or cleanser, they spray it on there, or iodine, not iodine, some type of liquid. Anyhow, they spray it in there and they push this in there. Okay, then they turn around and I'll take one of these, which is my gauze, my ABA band, extra absorbent band. I'll place it on top, and then I'll try to make sure that there's nothing touching the actual hole of the wound itself. And I want to lay this flesh over the skin around the wound. And then sometimes, for good measure, it depends on the nurse that you have, or if you're the person doing it for your nurse or whatever. You take some more this wound spray here, or not wound spray, but skin prep. Sorry about that. Skin prep here. You spray it around. And then you just make sure that it's flesh going to the skin. There's no holes or anything like that. And then, of course, when the person lays down, hopefully you want a pillow or something to have that area kind of propped up so they don't have any pressure on it. Usually wounds like this come from pressure sores. You normally see it on elderly people or people that are paraplegic. They can't like walk and can't properly shift their weight. So this is a big thing for people to know, learn, and be 100% skilled in it. I know I might sound kind of goofed off doing this, but trust me, I did plenty of them in the hospital, and I might not be able to recall everything, but I know exactly all the steps, kind of, for the most part. Oh, it sounds like crap. Anyhow, let's see here. I explained all that. Explain why each layer is used to do the proper dressing. Basically, each layer of each tissue, or in this manner, it would be like a wet gauze. Each one goes in to pack into the wound itself, to push the layers onto it, to help fill that gaping hole within the wound, and to make sure that when the person goes to lay on it, they're not making it worse, and it helps the skin rejuvenate itself with a liquid, or some people use like a medication, like a oily type of medication. And with that being in there, it kind of helps the skin grow and get better and get more healthier. And worse, and I would classify this as probably like a level, I don't want to say I wanted to do a level 4. A level 4, I probably would have had a lot more gauze really packed in there. This would have been really sticking up more, because the hole, you can almost see the bone to that. So you want to make sure that everything's packed in. And then sometimes with those situations, you might see a situation where they might have a hose sticking out for a draining tube. And not necessarily a draining tube, they might have a wound vac, and that can get pretty ugly. But that's for wound care nurses, period. The person that actually does this procedure, this surgery, would be either your surgeon, sometimes your doctor, and surgical nurses. Wound care, I don't see them picking away old wounds necessarily, besides for cleaning them and repairing them, so I wouldn't say necessarily that they do them. But again, my name is Kayla Green. Hope I got a decent grade. Sorry, and have a nice night.